Hello, future doctors. How are you all? Welcome back to MedSteps YouTube channel. So today we are going to discuss about history taking of ear and some hearing tests. So why we have to do this thing? So a simple ear history can help us to diagnose conditions like hearing loss, infections, and vertigo, and even neurological disorders within a minute. So today we are discussing in very simple, structured clinical way. So these are the examination and physical tests very important for our Viva and OSCE in end of the clinical rotations. Okay, so let's start. Whenever we are taking any history, first of all, we have to go with demographic data, means patient details and like name, age, sex, and marital status, and these are address and contact number. So these are the things very important. After demographic data, we have to go with chief complaint. In chief complaint, we have to ask that patient why the patient came to hospital. So what's the main concern? So if some patient will tell like is getting ear pain. So ear pain we called Otalgia in medical language, in medical terminology. Next one, we can see some discharge. With the discharge, patient will come, we call that is otorrhea. And some patient will come with hearing loss or changes in hearing, or maybe they are going to get some difference. Like in one ear, they are not going to hear properly, and another ear they are hearing good. So some patients will come with hearing loss. Next one we can see tinnitus. It's like tinnitus means ringing sound. And next one, some patients will come with vertigo, like spinning sensation, and some people will tell like I'm getting more amount of itching and fullness in ear. So these are the main chief complaint patient will come with mostly ear with the ear problems. So next one, if you are going with history of presenting illness, this is the main important for diagnosing any ear conditions. Okay, so in history of presenting illness, we are going little deeper. So first one, if any patient coming with, for example, ear pain, first of all we have to ask that onset. It's like sudden or gradual, or it's like weeks or days, months, and then after we have to go with duration and nature of the pain, like characteristics. It's like sharp pain or dull pain or what, like throbbing pain. And some patients with ear pain, sometimes the patient will get radiation pain also, radiating pain to jaw or head, or some patients will come with ear pain with the fever also. So some associated fever, infections, these are the things. So if any patient have infection, the patient will get pain mostly in otitis, we call like otitis media means middle ear, otitis externa, that means outer ear patient will get pain. And some patients will get like referred pain, like if any patient have dental caries, okay, a dental pain or throat pain, it can radiate. Okay, so what are the contributing factors can cause ear related problems? Means first one, trauma and recent illness and exposure to sudden loud noise. And next one, if any patient like swimmers, they are very prone to get otitis media. Okay, and mostly we can see this type of ear related problems in children. Okay, next one, which ear affected and does any make it worse or anything make it better? That means any aggravating factors are there or any relieving factors is there. We have to know that things from patient. So some patients will come with discharge. Whenever patient coming with ear discharge, we call otorrhea. Like what type of discharge they are getting, like watery or purulent or bloody discharge. If the discharge will be like smelling or duration, and the discharge will be like continuously or intermittent. And the important clue will be like some patient will get if any patient have chronic infection in ear, the smell, the discharge smell will be like foul smell people will get. If any patient have any traumatic incident or history, the patient will get blood or we can suspect tumor. Some patient will come with changing in ear, hearing. Changing in hearing, we can tell like hearing loss. That hearing loss we have to find out like its onset sudden or gradual, or type like unilateral or bilateral, or it's like progressing, or any associated symptoms like more amount of wax or infection, or sensorineural means neural problems. So we have to know these things. So these are the things we will get based on what are the questions we are asking in history of presenting symptoms or presenting illness. If you forget something, we are not going to get proper diagnosis, so it's important. So next one, some patients will come with tinnitus. Whenever patient coming with tinnitus, the patient will tell like I'm getting some sound like ringing or buzzing or pulsatile like ringing sound. That sound will be like continuously or intermittently. So we have to know these things, because sometimes the Meniere's disease patient, or if any patient taking like aspirin tablets like long time prolonged time, if any patient using, means they are going to get this type of sign and symptoms like tinnitus. Okay, next some patients will come with vertigo. In vertigo, like vertigo means spinning sensation or duration of episodes of dizziness, or whenever they're trying to move they are getting the positioning causing vertigo, means BPPV, benign paroxysmal positional vertigo, also can cause this type of vertigo. Okay, some if any patient have vestibular dysfunction, this dysfunction can cause this vertigo. Okay, so these are the history of presenting illness is very important while taking history. Okay, and some patients will come with associated symptoms like fever, nausea, vomiting, headache, and facial weakness. So we have to know the things. Next one, we can go with past medical history. If patient have any previous ear infections or recurrence or surgery or trauma, we have to know these things. Next one, medical history. These are the things very important. If any baby have like hypoxia at birth or low birth weight less than like 1500 grams, if patient have any congenital abnormalities of the face or skull, these are the things important in children. And maternal drug use, because while in pregnancy, if they are using like gentamicin, or we have some drugs can cause like aminoglycosides, ototoxic drugs. If the mom use this type of drugs, they are going to get some congenital problems in ear related things. Okay, so that's why maternal drug use is very important. Next one, head trauma and ear trauma and genetic disorders like Meniere's disease and chronic and acute infections like ear related infection, sinusitis, cold and flu. So these are the things will comes in medical history. Next we can see here surgical history. If any patient have any before any surgeries done, or sinus surgery or head and facial surgeries and neurosurgeries. So these are the things important. Next one, medications. As I mentioned before, in medications like many medication can cause ototoxicity, for example aminoglycosides and gentamicin sulfate and large dose of aspirin I already mentioned. Next one, social history. In social history, the patient is have more amount of exposure to loud noises at work, or if patient have any industrial noise exposure or recreational noise. So these are the people have problem with tympanic membrane or eardrum. So that patient will lose some hearing capacity also. So that's why social history is very important. Next one, family history. In family, anyone have hearing loss problems and genetic disorders, we have to rule out. Okay, so this is the history taking. How we have to take history taking, we covered. So now that what are the history taking we took. So now after that we have to go with physical examination. Next one, hearing test. So these are the hearing tests is very important, because this is the main things will help clinically in exams. Okay, so in hearing test, first of all we have to check external structures in inspection. Here the ear pinna, that auricle, color, texture of the skin, and patient have any moles or cysts or nodes or deformities, we have to check in external structures. Next one, any skin changes or cancer like basal cell carcinoma and melanoma. So these are the cancers mostly we can see in pinna or external ear. Okay, so if any patient have any signs of swelling and redness, or patient have any discharge, in inspection we can easily appreciate. So while doing palpation, if patient getting any pain or tenderness, or the skin structure changed, or if any patient have any lesions, we have to check with infection. If pain increased in external ear infection, then we call otitis externa. If patient don't have any pain and that patient have middle ear infection, then we have to suspect because if otitis media, because otitis media means middle ear infection. So if patient have middle ear infection, the patient can't, okay, whenever you are palpating external, the pinna, so auricle, the patient is not going to get any pain. Then we have to differentiate with the external otitis externa and otitis media. So this is the very important to differentiate in these two pathological conditions. If in mastoid area, if patient have tenderness, we have to suspect patient have mastoiditis. Okay. So next one, here we have one instrument in clinic. We call that is otoscope. Okay. So this is the main otoscope will help to visualize what problem in ear in ear canal, if patient have any problem. So this otoscope will help to visualize. So this is we call external auditory canal and to visualize the tympanic membrane. So this otoscope allows to examine the external canal as well as tympanic membrane and a few inner ear structures like tympanic membrane have what are the structures. You can see everything. You can it will be visuable. We can easily appreciate through this otoscope. So how we have to do examination? This procedure means, first of all, this is the main part we call speculum. This speculum will be like little, that length we can the length will be like, the earpiece will be like big. Why? Because it have to go inside the ear. Okay. Then after gently we have to grasp the top of the left ear with our left hand, and whenever you are pulling back, that time you have to straight, and whenever the speculum will go inside the ear canal, then easily you can, that scope easily can go inside and you can easily visualize the tympanic membrane. So while seeing in this window, we have one, this is the viewing of window. Easily we can see with our eye. Slowly we have to move that scope. So wherever the patient have pain, but mostly for seeing tympanic membrane, we have to move that speculum to way to the nose. Whenever it's going near to nose angle, then easily we can see the tympanic membrane. Okay, then after we have to show some attention to the external canal in the settings of infection called otitis externa, and if that walls are red and swollen and while seeing speculum, then we have to suspect some infection is there inside the ear canal. Okay, so these are the things. So if you're seeing this part, so the tympanic membrane, you can see this type of tympanic membrane here. In this tympanic membrane, also known as, we call this is eardrum. So easily it will be like visible. So if you are seeing in this tympanic membrane, you can see this type of structure. So here the color will be like translucent appearance, and grayish. If patient like it will be like grayish and translucent means if that eardrum tympanic membrane don't have any holes and everything, so that is the healthy tympanic membrane. So here we can see some structures. So this is the malleus. Okay, so and these are the things we can see, and one of the bone of the middle ear touches the eardrum. Okay, so these are the things. If you're seeing here, this is the LPI, this is the healthiest translucent membrane. So easily you can see the backside, what are the structures we have. Easily through translucent we can see easily. Okay, so this one, center of the drum and end of the malleus structure. Okay, next we can see that is light reflex. This is the right. Okay, whenever you are passing light with otoscopy, you can see this type of light structure. And here this is the lateral malleus, this is the mid, here you can see that attacher point, and this is the lateral process of malleus. Okay, so the tympanic membrane will look like this. So in the setting of infection within the middle ear, the drum becomes diffusely red and the light reflex is lost. The fluid collecting behind the drum, this is called middle ear infusion, and can cause drum to bulge outwards. So We can check with this otoscopy, and we have some special test. In that special test, first test like whisper test. Whisper test means one person stand behind the patient and we have to whisper numbers or words like 96 or 77. If you are telling like through whisper, the patient repeatedly, if the patient is telling correctly, the patient won't have any hearing problems. Next one, watch stick test. That means if patient wearing any watch, the patient have to listen that the patient have to bring the watch ticking closer to ear, and the patient have to compare both ears at a time. Okay, next test will be like with tuning fork test. This is the most important because we are going to use 512 Hz tuning fork. So here this tuning fork is very important to detecting conduction and sensorineural pathological conditions. Okay, so if you're seeing here, first of all, we can see here that is Weber test. In Weber test, we have to place the tuning fork on forehead, same to same. You can see here, same to same this type of image. So here we have to keep the tuning fork on the forehead. Then after we have to interpret it with normal sound in midline, and the conductive loss. Any lateralized affected ear will be like the sound reduced. In sensorineural, lateralized to normal ear. So this is the Weber test. Next, we can see Rinne test. So this Rinne test, we have to place the tuning fork on mastoid bone for checking conduction. Then after we can see then after we have to keep that tuning fork on near to ear for checking air conduction. Okay, so here bone conduction and air conduction is important because while doing interpretation, then in normally the air conduction will be like more compared with bone conduction, that is sound and everything vibration. Okay, if patient lose conduction means the bone conduction will be more compared with air conduction. Okay, if patient have any sensory neural problem, then the air conduction will be more compared with bone conduction, but it will be reduced. And we have another test, that is absolute bone conduction ABC test. We have to compare patient with examiner. And we have some advanced hearing test we call pure tone audiometry. It will help to measure hearing threshold and differentiate conductive versus sensory neural. And speech audiometry, it will help to assess speech recognition. And impedance audiometry, also known as tympanometry. You can see here, this is the main tympanometry, will help to check middle ear infection. Okay, so these are the history taking of ear and physical examination of hearing test. Okay, so always we have to correlate history with tuning fork tests. This test will give diagnosis in most cases without any expensive investigations. So if you found this video helpful, don't forget to like, share and subscribe. So we will meet in our next video. Till the time, take care. Bye bye.